A good night's sleep is hard enough without worrying about leaks. Attend's Sleep Comfort Premium Overnight Underwear is designed to help you stay dry and comfortable through the night with up to 12 hours of overnight protection. These premium incontinence underwear offer advanced absorbency and a secure fit that works while you rest, even during extended sleep. It offers premium overnight protection without a premium price. Visit attends.com for more information.
Welcome to Life Without Leaks, a podcast by the National Association for Continence. NAFC is America's leading advocate for people with bladder and bowel conditions, with resources, connections to doctors, and a welcoming community of patients, physicians, and caregivers, all available at nafc.org.
Welcome back to another episode of Life Without Leaks. I'm your host, Bruce Cassover, and joining us today, as always, is Sarah Jenkins, the Executive Director for the National Association for Continence. Welcome, Sarah.
Thanks, Bruce. I'm so glad to be here.
Yeah, me too. Today, our guest is Dr. Ehsan Navabi. He's a board-certified gastroenterologist, a hepatologist, and an obesity medicine specialist as well. He currently serves as the director of the IBD Center and the GI Motility Disorders Lab at United Medical Doctors in California, where he works with patients who have inflammatory bowel disease, complex motility disorders, and a whole range of digestive health conditions. So, Dr. Navabi, thank you for joining us today.
Oh, thank you. Thank you so much, Bruce. And thank you, Sarah, for inviting me here. And it is an honor, actually, to be talking to you guys. And I'll hope that basically we have a very good conversation about something that basically is very dear to my heart, about basically helping our patients with the struggles that they have. No, thank you so much for your invitation.
Yeah, this is not a comfortable subject for a lot of people. And I'm wondering, you're on the other side of things. How did you get to be where you are today, where this is sort of the focus of your career and your life's work?
Oh, thanks for asking that. So, as you basically mentioned, medicine has been my passion. So I did my training actually in Iran, but I was practicing for a few years in Iran. And in 2012, basically, I came to the United States. And gastroenterology is basically something that I was always looking to. It came from earlier stages of my training. And I got lucky enough to get to Penn State, which I had a very good chance and opportunity to basically get to work with very giants up into the gastroenterology. They're folks that they helped me a lot. So I did my training basically in general GI, but I had very good exposure to inflammatory bowel disease because of obesity. And also, it was one of the initial centers that basically in the United States started to focus on Wasilla. So I was blessed. And after that, I got an opportunity to go to New Jersey. I was attending and basically teaching at Rutgers University. At the time, I was director of both motility disorders and also inflammatory bowel disease disorders. And then life brought me to California, and I'm basically being blessed to have a very great team and working with the greatest patients in California, and hopefully I can help them.
Well, that's quite a journey that you've taken. So you really have been all over the place. It's pretty cool to hear. So tell me this, when a patient, speaking of journeys, winds up in front of you, if somebody let me put it this way. People are very good oftentimes at either ignoring or downplaying whatever's going wrong with them. And they will put off seeing, many people will put off seeing a doctor until they really have no other choice. At the point that people are seeing you, what stage are they usually at? Or do you get people who really sort of do head things off early, or are most people sort of pretty deep into their issues before they even get in front of you?
Well, that's a very great question, and the best way that you can basically bring it up. So I would say that it all depends basically on the acuity of their symptoms. All right. So most of us, especially for basically some delicate subject matters that we don't feel comfortable to basically open up the conversation, we try to put it in a basically back of our minds. We try to say that it's going to resolve. And one of the things that happens after a few years, few months, it just becomes new normal. And we get so much used to those symptoms that they're not actually normal, but because we're used to that, we think it is our new normal. And till the time that unfortunately may progress to the time that affects our quality of life, it becomes so disruptive, and they come by and basically seek medical help. And it is interesting part that when you hopefully can basically help your patient and they start to feel better, say, oh, I forgot how I was basically normal life mean to me? I mean, when I didn't have any of these disruptive symptoms, but I want to put it this way. If they have very acute symptoms, all right, especially if they have some alarm signs, let's say you have a patient that comes bleeding. So these are the ones that they worry about too much. And basically they try to seek medical attention sooner. But sometimes these symptoms are more chronic. And basically, as I said, people may not feel more comfortable to talk about them. So sometimes we have years, I mean, that the patient would come to our clinic for the first time to have the discussion and conversation. And I think that's the most important factor, that we start to dig in and figure out when was the first time that essentially patient started to feel these symptoms. And more importantly, it is not just the gastrointestinal presentation of that, the way that it affects their quality of life. I think that's something that's very important, because it affects their work, their life balance, many factors that I'm hoping that we can discuss today about.
Yeah, absolutely. We're talking about symptoms, and I'm wondering if there's a common family of symptoms that tend to get people to come and see the doctor, or is it really a mixed bag? Are there certain symptoms that people can more easily ignore, and other things that really do sort of send them running to the doctor? What do you see?
Yeah, I mean, I think it's both ways, all right? So some of them, especially in gastroenterology, the symptoms sometimes they're not always specific, right? So let's put it that way. Bloating, it's something that we get used to. Changes in bowel habits is something that we get used to. Sometimes it's normal to have them, all right? So you have it for a day or two, and they are pretty minimal. But at some point, they become chronic, and you're dealing with that on a daily basis. And without us knowing, they're affecting your life. And these are the things that basically we don't pay much attention to. But sometimes the symptoms are basically more abrupt. They're basically more concerning, as I mentioned, bleeding, very significant changes in bowel habits, including very significant diarrheas, progressive unexplained weight loss that we have, or severe abdominal pain. So these are the ones that maybe the patient seeks attention sooner than later. But more than often, I would say still many of these symptoms are chronic. And by the time that the patient comes, and usually the opening sentence that the patient has, doc, as long as I remember, I was dealing with these digestive symptoms. And it is very interesting that it becomes so normal for them that they already come up with some sort of diagnosis. And when you dig into that, you see that it's either something simpler or even more basically significant. But I would say that in gastroenterology clinic, it is very, very common that we get to see patients that they're already dealing with symptoms for longer term, except if you have some of those alarming symptoms, as I mentioned, that they were more acute and more concerning to the patient.
It reminds me of, the story of, the frog in boiling water. You turn up the heat, the frog doesn't even realize that it's boiling until it reaches a point where it's in real mortal danger. And one of the things that I wanted to ask you about in particular, because we really get a lot of questions about, is urgency among the family of symptoms. And like you mentioned, that there's, sometimes things just happen. You ate a bad fish, and for the weekend you have terrible symptoms, but it goes away. But urgency that's persistent, what should I be looking for as sort of a warning sign, both in the symptom itself and length of time that I've had it before I go to a doctor?
I think that's a very great question. So I want to make it very, very simple. If we have a bowel urgency, that I think that basically affects our daily life, that we have it in our basically the back of our mind as a concern all the time, I think that's regardless of how simple we think it is, there is always a solution for that. So I want to make it very, very simple. If you want to go out with your friends and your concern is, you know what, maybe I should check to the bathroom. Do I know where are the bathrooms around? Or I'm avoiding going out with my friends because I'm worried about the symptoms that I have. It's not normal. So it is something that we probably can look into that, and hopefully we can help the patient. So I think that seeking medical attention and basically medical care can help. If you are seeing that you are avoiding the jobs that you like simply because you have a fear of basically the job situation that may not allow you that ease of access to the bathroom, that is something that basically I think is very basic, that we have to help our patients and basically get them back to normal life. I want to go a little bit further in. I mean, we do see this in a younger patient. Even it affects sometimes the intimacy, right? So that's something that basically is out there. And if you're worrying about this there is always a chance that we can have a solution for this problem. Or if the simplest thing, I mean, going to the mall for shopping. I mean, if you have to make the shopping so short that you're worried about these bowel urgency that you cannot make it to the bathroom that easy, all right? That's the time that you have to basically try to think that there may be some answers for these, that we can get treatment. So that's the very basic one. Anything that affects your quality of life probably needs a medical attention. On top of that, there are some basically more concerning factors, all right? So if you start to feel that, oh, I'm looking at my weight for the last 6 months, all of a sudden I lost about 10% of my body weight, that is something I definitely need to ask your doctors basically to see what's the reason for that. If you're not sleeping at nighttime because of the urge that you have and affects your quality of life, that's a time that basically you may need to seek that attention sooner. If you're seeing the changes in bowel habits that all of a sudden you have frequency in the bowel movements beside the bowel urgency, that is something that probably need to seek attention. Or if you see bleeding with the bowel movements, that is something that basically will trigger those alarm signs. If there is severe abdominal pain beside the bowel urgency, so it is not just the concern that I may have incontinence and basically I have to basically find a bathroom. No, but I have severe abdominal pain. I mean, literally, it affects my daily life with this pain. I'm cramping all the time. These are the times that probably we should seek the medical attention sooner than later. And hopefully we can catch up and basically treat the patient sooner so we could get them back to normal life.
Now, I think all that makes perfect sense. And these are obviously signs of things that are not going right in your body. But it seems to me that the hard part is admitting it, speaking up. Because even though you know something is going wrong, I mean, this is tough to talk about to anybody. What do you say to a patient who is concerned, they're embarrassed, they're afraid, they're ashamed? What do you say to get that patient to actually make the phone call, talk to the receptionist, and get into your office?
I think that it has 2 points, all right? One comes from us as physicians, and I think that's the most important part. And I think that I'm very lucky to have very great colleagues all across the world. But I think that one of the beauty of the medicine, I remember when we were in medical school, there was a basically course that you would start to learn about the signs and symptoms of the disease. And in the textbook, there was a famous quote and saying that the beauty of the medicine and being a medical doctor is you get so close to your patient in a few minutes that they will share the information with you that they will not share it to their closest friends, closest family members or relatives. So that's a trust that you build, and basically that safe environment that you build for your patient, that they can trust you and they share the information, they feel welcome. So I think that the most important part, I still think that basically comes to providers, just to make that environment so safe that the patients, and that can be the primary care physician, can be gastroenterologist, can be the gynecologist, any physician that you see. And again, we are lucky that we across the world have the greatest BCD doctors in the world, or BCD healthcare providers in the world, that they can provide that situation. But knowing the fact that basically that environment is available to us, then the next question is, what would be the next step to hesitate about this? All right. And I think that nothing is more important in our life than one time that we are living to have the best quality of life that we can have. All right. And there is no reason that we basically delay this care that we can receive as much as possible. So while we think that these are the matters that we feel shy because socially, these are not the things that we discuss as much. Basically, these are the things that we try to basically avoid mentioning them because of the stigmas that unfortunately has been presented basically around us before. But one thing that is important is our health is important. When I'm healthy, I can do better. When I'm healthy, I function better in society. When I'm healthy, I can enjoy the time that I have with the family, and also I can enjoy the time that I have with the friends. So then we'll try to avoid any obstacles that can prevent that. I think when these things happen, the first thing that comes to mind, I would say the first basically to start is your primary care physician, that you basically build up the trust. You know them, you see them frequently. They know all about you, about your kid, the grandkids, everybody basically was in your life. So maybe it's a good start to pick up the phone call and just say, hey, I need to be in touch base with my primary care, right? So I just have an issue that I want to discuss. And then when you go to the clinic, I think that's going to be the best time that you start to express. And I'll get to the point that it's an art, how we ask questions from the patients and how patients can bring that up. And I think that's very important. But I think that the first thing is a reluctancy to consider to basically asking for care from the doctors or healthcare providers. It just basically affects the quality of life. And any seconds, any minutes, and any basically years that we're missing at this point, it just affects basically our life, the precious life that we have. So I think that basically, if you feel that today this is something that you have a subtle concern or you think is a major concern, pick up the phone, make that appointment, get into one-to-one with your healthcare provider. Hopefully there is a way that we can help.
One thing that we hear a lot on our end is patients go in and talk to their primary care, and the primary care might not know exactly what's going on yet and is trying to figure out, but it sometimes takes a really long time for those patients to even get to someone like you. Do you have any advice for them to move that along a bit more quickly?
No, absolutely. Part of that, as you know, it depends on what type of access that we have to healthcare, right? So sometimes, regardless of basically having every year so many great graduates joined into medicine, we still basically struggle to have enough providers, even at the areas you think that basically you should have access to the providers very easily. It's very challenging. And hopefully, as time goes by, we can have more providers available to the patient with easier access. But I would start with this. When we go and see our primary care physician, the big thing is we share the importance of the matter. All right. So I think that's going to be the first conversation. The first thing that happens is for many of us, we may not have that much of a great awareness about the bowel urgency itself, because that wasn't a matter that was brought up by the patient directly very easily. And we may not have basically that awareness about the bowel urgencies. And it may not be a routine question that comes up with the primary care physician or gastroenterologist. All right. Hopefully that will change. And I think that basically there is especially in gastroenterology, there is a very significant campaign for bringing up this awareness. But I think that also can help from the patient that if they don't feel shy to bring up the question, just simple question from a doctor. As simple as, doctor, I think that I'm worried about basically my bowel habits now. I think I'm struggling that basically at some point that I'm always concerned about if I can make it to the bathroom on time. And it affects my life. I cannot enjoy my time with the family. I had missing time from work. And is there anything that we need to do about this? Or is there anything concerning? And I'm pretty sure that triggers that basically question mark for the doctors to start to ask further questions to figure out basically what are the causes of these, the differentials for basically the etiology. And honestly, many of these parts can be basically easily handled even by primary care physician. And of course, there's always some complexity and more complex forms that you may need to seek subspecialties like gastroenterology or motility disorders. But there are still certain workups, and I would say still maybe 80-90% of the workups that can be done at the level of primary care easily, at least to reassure that there is no alarming signs, the patient doesn't come with anemia, the patient doesn't have any bleeding, and assessing those. And then doing some basic therapies and treatment. If that doesn't work, then for sure, I think that patients and physicians should have the conversation that it's just important to have another level of care, attention, to help them to basically resolve the symptoms.
Thank you. That's great.
I'm wondering, with what you're talking about, do you also see a difference between the way men and women come to see you in terms of not just what they're presenting physically, but in terms of, what it actually takes to get them through the door?
I think that's very important. And in both sides, basically there is limitations, right? So number one, women basically may tend to be more comfortable with the female providers to share this information. And again, it's my role as a physician just to make this very comfortable environment for having that conversation. So that is something that's being missed. All right. And especially if those are the quick visits that You don't really go into the detail. I mean, the patient comes really having this question in the back of the mind, but the physician's attention is to something else. And you do not build up that basically environment to have the conversation. So that is something that basically happens. And for men also, it is something that basically they are somewhat more reluctant to talk about these two. And again, this goes back to basically many unfortunate social norms that has been existed for many, many years. But I can say this, and I'm going to give you basically a story. So I do inflammatory bowel disease, all right? And that is something that's very routine with that I do. And as a physician, it was like 2018, 2019 that we had a very major study that started to talk about bowel urgency and inflammatory bowel disease. That's how disruptive it is. 50% of people basically are wearing diaper once a week. And that was basically a shock for me. I had no clue about it. And I'll come to that point. I probably did not ask this question much from patients. So now basically when this awareness comes, then the physicians feel more comfortable to ask this question. Hey, have you ever had any trouble that basically going out with your friends that without basically having concern of an accident? Or is bowel habits is something that is of your concern on daily basis for you? Is it something that you think about it too much? All right. Is there a good opening? I mean, we don't have to all of a sudden start with the details that people feel a little bit shy about it to open that up. I think that when you start asking that, then the next question, hey, what about diarrhea? Do you have any diarrhea? Or as simple as that. I mean, has it ever happened that you feel that you may not be able to make it to the bathroom and you may have an accident? And with that started, then you can basically make it to that next question that I think that almost everybody tried to avoid having that conversation, that actually, if you ever had accident, because this is an experience that basically, I cannot make it basically any simpler. It's considered to be embarrassing for all of us, right? So we don't feel comfortable to share this if you're not asked. And I think that basically that is something that we have to delicately open up and basically discuss about this. At some point, again, if it is a disruptive matter, and even if you feel that your healthcare provider did not get to that point because they were basically targeting the other parts of the medical problem, I think it's very, very important that we proactively bringing that up to, hey, doctor, there is another important issue that I want to discuss. And I know it is not a comfortable subject to discuss. It's never comfortable. And nobody wants to open up about it. But I always say, let's step back a little bit and see that if I can fix this problem, how much I can have better quality of life. I mean, we think about that. I think that it will help us to be basically more proactive to seek the help.
You know, you talk about fixing the problem. And I suppose that really is the ultimate goal. I mean, if some of these things can actually be treated to the point where they either go away or minimized so much that it's not really a bother anymore. Is that sort of degree of relief achievable with modern medicine and therapies and treatments?
That's a very great question. And my answer is for most of these bowel urgencies, the answer is yes. All right. But it all depends on what's the cause. But I can tell you, I mean, if it is an inflammatory process because of basically infection, yes, you treat the infection and this will resolve, all right? If it is basically inflammatory process because of an autoimmune disorder like Crohn's and ulcerative colitis, that's a target. And we still have very great medicines that we can achieve basically with almost complete resolution of bowel urgency. And that's the area of the study. If there is basically treatable bowel syndrome as a cause, all right, so we can still basically modify the lifestyle, modify the medicines, and we achieve the targets and goals. And sure, there are some other ones that basically are more challenging. If somebody had very bad neurologic damage to the spine that essentially do not have the control, mostly they do not feel the pain or urge. But if they have the urge and they do not have control, then it's more challenging. But it doesn't mean that if we cannot stop basically the bowel urgency, we cannot basically give them a solution to have a better quality of life. All right, we can basically handle the way that the bowel habits are happening. We can handle the way that transit time happening. So, or we do have some sophisticated treatments and therapies, including special physical therapies, pelvic floor therapies that the target is just to make it go away. And that's a hope for all of our patients. But at least we can basically make it to be better. We can make it the way that it is predictable. so we can get back to our routine life as much as possible.
I would imagine that for a lot of patients, even predictability would be a tremendous success. Because you know what? Living with this has got to be very, very challenging. And I'm wondering if maybe you could talk a little bit about sort of everyday life support. What strategies might patients who either they haven't yet started their treatment journey or they've just begun it and they haven't sort of reached that point of predictability, what strategies might they use to help them manage the unpredictability of day-to-day urgency?
That's a great question. And again, it goes back to the etiology of the disease because it's not always basically as simple as basically one strategy to do that. But the thing that we see a lot in our patients basically routinely being happen is the one that basically we try to avoid as much. And that's basically they're wearing the protection, right? So that's something because they want to be out and they're worrying about it. And there is a basically hallmark study in basically IBD that was showing about, as I said, 50% of people with Crohn's and ulcerative colitis, 47 or 50% basically they are wearing some sort of protection once a week, while the doctors are feeling that they're in remission. So that is something that basically it's something quite often happens, but I can tell you that how much it can affect brings up anxiety, depression. You had a 22-year-old that basically walks in your office and when you examine all of a sudden you see that they're wearing the protection, right? So that's nothing that you would expect to see routinely. Even if you have older patient, that is something that basically you don't expect to see routinely. So then it goes back to the etiology. I would say that there are some certain points that basically you adjust basically the timing of the bowel habits. You try to schedule your bowel movements on certain times. So you know that you were going out, you wouldn't have basically the problem there. You adjust the type of food or the timing of the food that you have, but I have to be very, very clear about this. Sometimes with some diseases, it's not doable. So that requires the medical attention. And sometimes with the it's not basically doable. I mean, you have a person that has to be at work at 6 a.m. and their concern is they have to have at least 3 or 4 times bowel movements before they get out of house. So I have patients that really will wake up at 4 a.m. just to be sure that they can make it. So it is not that easy to have a routine strategy. So that is why I think that seeking the medical attention and looking for etiology can help to come up with a better strategy than having a broader strategy to prevent that.
Well, I certainly will take what you said as really encouraging, the fact that in many or most cases, the treatments really can be effective. And we hope that people who are listening to this today take away a lot of different lessons, but among everything, that's sort of the one that they take home more than anything else is that, yes, treatment works if you go out and seek it. So I really appreciate that. But as you know, this podcast is Life Without Leaks. And one of the things we always like to do before we leave is give our listeners one little hint, tip, strategy, bit of advice to live a life without leaks. Now, usually when we're talking about things is in reference to bladder leaks, but the bowel is the subject today. So I'm wondering if you might have a single bit of advice that we could share to help people live more comfortably and more healthily as well.
Absolutely. So I want to touch upon a little bit for the reasons and the common ones for the bowel urgency. So one of the things that quite often happens and we forget about it, basically, surprisingly, constipation is one of the reasons for bowel urgency. So we think that basically having constipation would be exactly the opposite of bowel urgency. But the matter of fact is exactly the other way around. I mean, when you're severely constipated, I use this analogy of basically a clogged tube, right? So the only thing that just passes is basically just the liquid and the urge around. If this is something that is happening for us and we're dealing with constipation, I think that basically taking fibers, being sure that we're adequately managed for constipation, having adequate hydration, exercise, and all those things basically can help very significantly to have more regular normal bowel movements. And when you have prevented the constipation, then you prevented basically the bowel leaks that can happen for you. Because if there is an empty reservoir there, then you don't have much in a bowel leak that you would be concerned about. So that's one of the common ones. The other ones that we see basically quite often is basically irritable bowel syndrome. If I want to make it very simple, nowhere else in the body has that much connection to your brain as much as your gut has. We call it gut-brain axis. We still do not know what's the reason that the gut becomes hypervigilant. there is a terminology that called basically microbiota, that basically the bacteria that were basically living in our gut. And probably there is this fight within the bacteria that make this imbalance. But whatever reasons that can happen, could be basically medicines, could be basically food, could be environmental effects, or even a stressor. So one of the things that happened that we start to get basically this urgency to run to the bathroom. And usually we really do not have much of a bowel movement as well too. So one of the techniques to help with this basically irritable bowel syndrome is basically special dietary changes. But more than that, relaxation techniques, routine exercises, meditation, these are the ones that we are helping to prevent these impulses that goes from gut to the brain. So they are very, very effective. And of course, I mean, there is always a medical attention. And if there is basically more serious cases, like basically if you see bleeding, if you have persistent diarrhea, then for sure seeking medical attention, because there are treatable causes like autoimmune disorders or basically infection. But the more common ones, I think that if basically work on constipation management, if you work on irritable bowel syndrome, these are the important ones. And again, if there is alarms, if you're feeling a mass in the bottom area, if you're seeing bleeding, if you're seeing basically weight loss, then I would definitely recommend it. While we try to handle this at home, but it's much important that we see the medical providers.
Well, that is outstanding advice. And I certainly hope that people take you up on it, and certainly hope people don't ignore things that are, genuinely, threaten their health and their well-being and their sense of self also. So thank you so much for sharing all of this with us today. We really appreciate it, and I'm sure that our listeners do as well.
Thank you so much. I'm happy that basically we have this opportunity, and I'm hoping that basically we really don't have anyone that basically have to struggle with this, because we do have good modalities, good diagnostic techniques, very good treatments available that we can help majority of our patients to overcome this very important obstacle.
That's really encouraging to hear. I appreciate it. Thank you.
Life Without Leaks has been brought to you by the National Association for Continence. Our music is Rainbows by Kevin MacLeod. More information about NAFC is available online at nafc.org.